Good afternoon, morning, and evening to you all, wherever you are calling in from. Welcome to the Center for Disaster Philanthropy webinar, Supporting Communities in Crisis, Evidence on Funder Motivations, Barriers, and Opportunities. My name is Austin Snowbarger, and I am the Director of Strategy and Research at CDP, where I lead our research, learning, and evaluation work. Prior to joining CDP, I led the learning and evaluation portfolio at a private foundation. I also worked for development and humanitarian organizations, including in Haiti. I am pleased to be with you today to present and discuss research we recently published on philanthropic engagement in complex humanitarian emergencies. The role of philanthropy in development and humanitarian aid has come under the spotlight in the past year as needs soar and the international aid system fractures. Funding from governments is declining, and philanthropy is being asked to act and fill gaps. At CDP, we believe that philanthropy will not be able to, nor should it be expected to fill all gaps left by government. Yet, philanthropic organizations can play an important role in supporting communities in crisis. And I look forward to exploring this with you today through the sharing of our research findings and discussion with our panelists. Today's conversation takes place on the third anniversary of the start of the war in Sudan. And I also want to briefly pause to recognize the profound toll this conflict continues to take on Sudanese communities and the critical importance of standing in solidarity with those leading response and recovery on the ground. A few housekeeping notes before we get started. Live captioning is available now via Zoom. You can click on closed caption live transcript to access it, and these are available in multiple languages. We are recording this webinar, and it may be available on our website and YouTube channel later. When you leave the webinar, we have a very short survey for you to complete. This helps us improve our work, and we would appreciate it if you could fill it in. You can also submit questions at any time during the webinar using the Q&A box at the bottom of your screen. And we will try to answer as many of them as we can near the end of the webinar. This webinar has been promoted by Alliance Magazine, Council on Foundations, Giving Compass, Human Rights Funders Network, Network of Engaged International Donors, Peak Grantmaking, Philanthropy California, Philanthropy New York, Philanthropy Southeast, and United Philanthropy Forum. Thank you very much to all of you for helping us reach a broad audience of funders today. Let's quickly take a look at the results from our poll. Thank you for taking a moment to complete this. It helps us see who's in the room with us today. So it looks like we have a cross-section of different stakeholders, a lot of nonprofit and non-governmental representation along with philanthropic organizations. And in terms of familiarity with the role of philanthropy in humanitarian or crisis contexts, seems that most people here are slightly or very familiar. So I hope wherever you're joining us from and whatever place and position you are in our field, that you will enjoy the conversation and learn something today. Now it is my honor to introduce our presenters and panelists. Marina Kobzeva is a senior humanitarian practitioner and researcher with 19 years of experience across the Red Cross, UN, and international NGOs, spanning technical management and leadership roles at country, regional, and global levels. She currently serves as Director of Impact and Locally Led Practice at MAP Action and holds governance and advisory roles at Christian Aid, the Humanitarian Quality Assurance Initiative, and Accountable Now. Her work focuses on locally led, equitable partnerships and program quality and accountability. Marina was part of the team from Accountable Now that partnered with us on this research. Jason Chow leads emergency relief and humanitarian learning and innovation at the Gates Foundation. Over 20 years, he has worked at the intersection of humanitarian response and evidence-based decision-making across the Gates Foundation, USAID's Bureau for Humanitarian Assistance, the White House National Security Council, the UN, and international NGOs. He came up through the field, starting as a Peace Corps volunteer in Niger and working in the DRC, Pakistan, Afghanistan, South Sudan, and Turkey. And that grounding shapes how he approaches the work. And last but certainly not least, Gloria Donate is the head of humanitarian aid at the Irene M. Stahilen Foundation, a Swiss foundation with its headquarters in Zurich. She oversees the humanitarian grant portfolio composed of national and international non-governmental organizations, anticipating, preparing, and responding to crises. Before joining the foundation in 2024, Gloria spent over 17 years in the aid sector, working with the European Union, Plan International, or Save the Children in several countries, including Jordan, Dominican Republic, Haiti, Cambodia, and Palestine. Welcome to you all, and thank you for sharing your expertise with us today. We will bring Jason and Gloria in soon, but first, Marina and I will share some highlights with you from the research. At CDP, our research agenda is focused on generating insights that will improve disaster philanthropy practice and help us advance our mission of mobilizing philanthropy to strengthen the ability of communities to withstand disasters and recover equitably when they occur. For years, we have focused on complex humanitarian emergencies through our intermediary grant making, education, and coalition building work. But we realized in 2024 the role of philanthropy in these contexts was not well understood, either in academic or practice-oriented literature, and we began developing a research plan to address this. This research that we're here to talk about today aimed to identify the challenges that prevent new or additional philanthropic funding for humanitarian emergencies, explore existing motivations for these funders in these contexts, and provide recommendations for overcoming these barriers. For us, the research aims became even more critical and relevant with all the changes we witnessed in the development in the humanitarian field in 2025. We will add a link in the chat to this research, and we encourage you to download and explore the full report. Before we get too much farther along, we do want to describe what we mean by the term complex humanitarian emergencies, or CHEs. At CDP, we understand these emergencies as large-scale crises driven by a combination of conflict, political instability, and social breakdown, often compounded by disasters or climate shocks that overwhelm a country or region's ability to respond. In simple terms, these contexts are not the result of just one disaster, but a situation where multiple problems overlap, making it much harder to respond and recover. Now I will pass it to Marina so she can share a little bit about how we went about carrying out the research.
Thank you so much, Austin. Hi, everyone. It's great to be here. So first of all, we conducted a desk review. That was review of secondary information into humanitarian financing, philanthropic giving, and shifts in aid. We used some of the data held by CDP and other data available publicly. Later on, we've conducted a survey distributed to philanthropic organizations and the intermediaries between the months of September and November last year. And we received 76 responses. Subsequently, we conducted 54 semi-structured interviews. 41 of them were with philanthropic funders, 4 with humanitarian alliances and think tanks, and 9 with philanthropy experts, networks, and collaboratives. Of course, it merits saying that the people who agreed to have an interview are those who are already funding complex humanitarian emergencies, CHEs, or are interested in them. So there is a certain bias in our data in that regard. Back to you, Austin.
This research cites our latest State of Disaster Philanthropy report as one representation of current funding for complex humanitarian emergencies. Similar to COVID-19's effect of drawing more funders into disaster, we have seen that Ukraine served as an entry point to these contexts for many funders. This is seen in the significant philanthropic giving for complex humanitarian emergencies in 2022. And although, as you can see here on the slide, funding declined in 2023, the proportion of CHE funding is higher than in recent previous years, which indicates some sustained investment. We will also add a link to this research in the chat if you would like to explore it further. Next slide.
So what are the current trends? First of the things that we've observed is that there is a lack of dedicated portfolios. One funder told us, we don't have a humanitarian program, but we fund in places that happen to be fragile or conflict affected. In the majority of cases, CHE funding reaches crisis-affected populations through existing sectoral programs that are already running in those contexts, support to long-standing partners in crisis zones, regional investment that overlap with fragile contexts, and occasional crisis-specific donations triggered by major events. This ad hoc approach seems to dominate across different funder types, corporate, institutional, and individual funders. As one funder told us, our crisis funding is reactive. If something catastrophic happens, we mobilize quickly. Then we return to our core themes. The decisions are made very differently amongst the different funder types, where individual funders using donor-advised funds operate with total discretion, while corporate foundations face a different constraint where the statutory geographic mandates are often tied to their business operations. And institutional foundations are dealing with a situation where program officers are accountable to the board, and the board is often seen as risk averse. Speaking about where the funding is going, it's important to say that funding is dominated by thematic continuity and not humanitarian specialization. Health and water and sanitation programs seem to lead philanthropic engagement, followed closely by education. Funders gravitate toward what they call tangible sectors, those that are easy to measure and relate to, and are greatly motivated by protecting their previous work's gains. It's also important to talk about who the funding is going to. One funder said, local organizations are closest to the crisis. We want to fund them, but we need help navigating the risks. Due to risk concerns and compliance requirements, almost 70% of survey respondents said that all of their CHE funding is going to international NGOs or the UN. And yet nearly every funder that we spoke to expressed a desire to support local actors more directly. Where local actors do receive funding, it normally goes via INGOs as pass-throughs, pooled funds or intermediaries, and established networks of community foundations. Many funders cited capacity on their end to engage in de-risked local funding, while there was a significant subset of funders who said that direct funding to local organizations is actually easy if you commit to it. Next slide, please. So what motivates funders to engage? First of all, it's proximity, identity, and connection. Engagement is driven by emotion. Identity and connection are not just strategies. Personal connection to affected regions emerged as the strongest predictor of sustained engagement. One funder described how earthquake response in Haiti eventually evolved in supporting 25 grantees over the 15 years that followed. Proximity and identity are strong predictors of engagement, including faith identity, heritage, corporate presence, and long-standing partnerships. You help your own first, one funder told us. That's how philanthropy works, whether people admit it or not. This helps explain why some crises attract philanthropic investment and attention, while others remain invisible despite severe needs. A lot of spontaneous giving by individuals to emergencies is based on that sense of shared humanity. Another funder echoed it. And these emotional triggers often drive one-off or initial engagement. And whether they evolve into sustained support depends on the experience the funder has in that context. And in recent years, Ukraine and then Gaza and then Sudan were such pivotal moments for many CHE funders. The other family of motivating factors are mission, legacy, and strategy. Mission provides essential justification, particularly for institutional funders. For example, education funders fund education in displacement. Climate funders support resilience in fragile settings. And gender funders support women's protection, while health funders support primary healthcare in conflict. Corporate foundations find mission alignment through their business presence, and some funders do see crises as pivotal moments where philanthropy can have a disproportionate influence. In a crisis, one funder told us, every dollar matters more. This is where history is being shaped. This is where philanthropy should be. Media attention is another strong motivator and shaper of funding decisions, particularly for corporate funders, managing reputational and visibility considerations. And last, but absolutely not least, actually the biggest motivator that has emerged in the course of the interviews that we've had with philanthropic funders is that the most important influence on a grant maker, as one funder told us, is other grant makers. It's not conferences, it's not studies, it's other grant makers. So grant makers watch each other and are greatly motivated by the choices that other funders that they look up to are making. Next slide, please. Of course, we had to look at the barriers as well. So what prevents new or expanded funding? Why some funders stay away from CHEs altogether? Well, first of all, it's uncertainty. More than risk aversion or resource constraints, not understanding how to engage in a crisis context is a fundamental barrier. Conflict contexts, and conflict is often, if not always, is mixed into a CHE context, triggers heightened fear amongst funders. Conflict is often perceived as messy, as too political, and this complexity is compounded by additional perception of these crises as being too remote, too dangerous, and too inaccessible to travel to establish that sense of proximity that we spoke about in the previous slide that would potentially allow funders to open up and engage in these contexts. Then there is a communication gap. Funders who spoke to us feel alienated from the humanitarian ecosystem, describing it as opaque, bureaucratic, unresponsive, and not designed for philanthropy. These are just all quotations taken from the interviews. Here is another quote. We are told to trust the system, but the system doesn't trust or respect us. Many funders reflected that they are often treated as ATMs, this is also a quotation, and not as thought partners, and that their convening and connecting ability within the sector is often overlooked. Now, there is another group of factors that we call reputational concerns. There is an issue with perceived political bias. CHEs obviously cross conflict lines and state and country borders. And some funders are worried about the social media amplification of any potential missteps that they might make and the brand impact that it might have on their organizations. Most philanthropic funders appear to be far more comfortable with financial risks, but it's the reputational risks that make them hesitate. Many expressed concerns about being drawn into public debates or criticism, and even when their intentions are strictly humanitarian. Legal and compliance barriers compound these fears. Another issue that came up time and again was impact. Funders want to know that their support made a difference. They want to leave a legacy. They want to leave a mark. And CHEs make this extremely challenging. As one funder told us, you can donate 1 million and still not know if it's made a dent.
Thank you, Marina. The last part of our presentation on the research highlights is solutions for increasing and improving philanthropic engagement in complex humanitarian emergencies. The first is funders respond strongly to human stories, local leadership, and evidence of resilience. And using narratives can help funders feel connected, not overwhelmed. Next, many funders want to support communities living through crises, but hesitate because the entry points are unclear or seemingly high risk. A trusted intermediary can help donors navigate unfamiliar terrain. For example, one person we spoke with said, "We want to fund locally, but we need someone who understands the terrain and can de-risk it." Third, we learned that funders are more willing to engage in CHE work if it aligns with their mission or thematic focus areas, as Marina touched on. One person put it simply, if you show me how crisis work fits my mission, you're halfway there. Collaboration, as Marina hinted at, as well, is a powerful confidence builder for philanthropy in complex crises. Funders that we spoke with emphasized that being a one among many makes it easier to engage in these contexts. As one interviewee said, if we do it together, it feels safer. No one wants to be out on a limb in a conflict zone. As mentioned earlier, funders want to support local organizations, but may lack clarity about how to do so responsibly. The research identified 5 areas of support that funders asked for: vetted list of trusted local organizations, due diligence, meaningful reporting, risk management through intermediaries, and pathways to strengthen local organizations over time. Next is when funders lack clear pathways and visibility into CHE contexts, even modest involvement can feel unstable. But when uncertainty is reduced, their risk tolerance expands. Simple guidance about real versus perceived risks, navigating sanctions or other legal considerations, and essential versus optional due diligence can go a long way. And lastly, in our research, also as Marina pointed out, peer influence emerged as a strong motivator in philanthropic decision-making. Funders desire to learn from one another, but in small, trusted, and confidential spaces where candid conversation is possible. As one funder put it, philanthropy is a herd. When a few move, the rest follow. So that concludes our presentation. The research report in its entirety and the full report is full of rich insights, and we do hope that you'll take the time to download it and explore that in more detail. But we are very happy now to bring back Jason and Gloria for discussion on the research and to learn more about their work in this area. As a reminder, you can use the Q&A box at the bottom of your screen to submit a question. And after a little bit, we will do our best to answer them very soon. So, Gloria and Jason, there's a lot to unpack and discuss about the research, implications for ourselves and other funders, and implications for partners. Let's just start by hearing both of your high-level reactions to the research. I know you've taken a look at it yourself. Gloria, do you want to start by sharing some things that stood out to you?
Thanks, Austin. Yes, I was really surprised and positively surprised when I saw the finding that there's many funders that want to support and engage actors, whoever they are in crisis context. Because what I feel as head of humanitarian is that I don't find a lot of peers. There is a lot of foundations and philanthropic institutions that might want to, but it's on education. But so I was really happily surprised that there are many funders. Not surprised that it's uncertain, but knowing that there is the willingness, I think that's a great opportunity.
And Jason, how about yourself?
Yeah, thanks, Austin. I think there were 3 big takeaways for me. I think the first is that there is a real desire from the philanthropic sector to do good in the world, and I think part of the challenge moving forward will be how to best channel that commitment and harness the resources that the philanthropic sector has to just help address some of the emergencies that we see in the world. I think the second is that there are really concrete opportunities to reduce the gap and barriers that are preventing deeper engagement from the philanthropic sector. I think some of your recommendations are spot on, and I think they provide a roadmap for how we can, constructively bridge that gap. And I think the third is, the report's to me a really good reminder that philanthropies are, like many other organizations, are very mission driven. And not every complex humanitarian emergency may align with what a philanthropic organization wants to do. And so I think there is a real need to be more strategic about how we identify where there's convergence between what a philanthropic organization wants to do and where the emergencies are in the world, right? I don't think it's a monolith.
Yeah, good points. Thank you for those perspectives and reactions. I think what'll be helpful, because you both come from different organizations, the philanthropic space, as we know, is very broad and it's a large umbrella with lots of us underneath it. To hear a little bit more about your individual and your organizational journeys in this work. So, Gloria, I want to start with you. You know, the IMS Foundation was set up a little more recently, about 7 years ago, and one of its focus impact areas is humanitarian aid, which you lead. Can you share about your and the foundation's journey as a newer organization to greater investment in humanitarian settings?
Sure, thanks, Austin. I mean, it does help by the start, right? That the board and the foundation wanted to work in humanitarian. So I was already given that remit as head of humanitarian aid, but it was definitely a journey and a discussion. What does it mean, humanitarian, and in what context? So I think some of the key learnings for us in the last 7 years, and for me too, has been with who do we want to partner? And I think Marina and the research alluded, we're one of those funders that we really wanted to support more proximate and local leaders in crisis response. And most of the partners that we had as a foundation were international actors. So we did had to take our board in a journey on how to pivot to support those local actors. And what we found is that often funders say it might be complicated, it's difficult, but I found there's multiple pathways to achieve this, right? I mean, it goes from you still can partner with your international NGO and make sure that they partner in equitable terms with local actors. We've gone through other routes, and that is to fund more locally. So fund local actors, we fund mutual aid efforts, and we're one of the funders behind the Resilio Fund because we think this locally led goes even further into that remit. There's also multiplicity of intermediaries and funds. It could be pool funds, it can be global. So for those funders that think it's either one or the other, I would say there are multiple pathways. And it depends who you are as a funder, your board, a number of things you can choose. So it's not a black and white. I think the other one that has been an interesting journey for us has been due diligence. Less exciting part of the work, right? But still necessary. So I think often due diligence has been used as a punitive exercise, right? So if an organization does not have X, Y, and Z, you will not partner. What we've learned is by using the due diligence as part of the design phase with the organizations we would like to partner, when there's been an area we identify that might need attention, let's say financial health, instead of saying, well, we will not partner with you. No, it is an opportunity. How can the program designed around it? This could be, do you need a particular software to do accounting? Do you not have reserves? How can we contribute? So instead of funders, I think we have to think, instead of saying, again, black and white, we cannot, what can the program realistically do? Because that is mitigating risk. That is part of the risk framework, right? If we want to work in conflict emergency and those organizations might not have certain policy, can we not fund so that they do have? And therefore, not just the program, your impact is at that organizational level. And I think the other one that has helped through with some of these changes for us has been proximity, which the report also highlighted. It does feel really removed from this very privileged bubble in Zurich, right, to work and support in Sudan. But then proximity means, okay, how can I get some of these organizations to speak not just to us, but to our board members so they feel confident and helps build trust? And that is also investing. You can pay for those grantees to come and meet. It can be you taking your board to this context whenever, obviously, it's safe and feasible. Because I think that proximity, building that personal rapport and trust, then would help both with who you partner, but also make them feel more comfortable about working in complex humanitarian crisis. I don't know if that resonates at all with you, Jay.
No, that's great, Gloria. I think the journey of IMS kind of mirrors where the foundation was. We're a little bit more established, but I think there's a lot of similarities. Um, for those who aren't as familiar with the Gates Foundation, the mission here is to create a world where every person has the opportunity to live a healthy and productive life. And that mission statement really drives all of the work that we do. We really do believe that our resources, if deployed strategically and with trusted partners, really can be impactful and catalytic in addressing a range of issues, including in addressing acute humanitarian needs. We really are committed to the idea that timely assistance is paramount and really saves lives. And that's why we're extremely motivated to work with partners, including a lot of proximate partners that are really excellent at that last mile delivery, because that's where we know the needs are greatest. And this reality that humanitarian needs are increasing at a much faster rate than resources is really a driving force for us, because we know that our contributions can really make a difference in being part of the solution. And I will say that having spent many years in the U.S. government side, one of the privileges that I think that we have in the philanthropic space is that we are not using taxpayer dollars. And so I do think that there is a lot more flexibility that philanthropic organizations can have. I think we can be a little bit more risk tolerant. I'm not saying that every organization is, but I think it's there if we want to be, if we want to push the boundaries of who we can support and how we support partners, that it's really a luxury to have in the philanthropic space. And I think it's part of the DNA within the Gates Foundation.
Thank you both. That's helpful to hear your organization's journey in this work. Gloria, what stuck out to me about what you were saying is there's so much work that has to do outside of just the traditional grant timeline. A grant is awarded and then a grant is closed. And so much of what you were talking about is building the foundation, having the conversation, et cetera. Can you just expand more on that and kind of the investment of time and effort, and then the return on that for the quality of grants that you are able to provide once that comes up?
I think for funders, or including for us, that are willing to support and engage in complex and protracted crises, you cannot just think this is a quick 3 or 6 months, provide some funding and then go, right? That would be irresponsible. So I think for us, it's clear that we might not to be able to support many countries, but the ones we do, you want to be a long-term and a quality partner. And I think this is a question of responsibility. You're going to contexts that are affected by multiple crises. This is not 1 or 2 years, it's decades. So you also have to go there very clear mindset. And you want to be a good partner. I like to think we could also be allies. And that means understanding the organization is not just the project. You want to understand, you want to make sure that in this partnership, as much as possible, you strengthen them. And that is not, again, on this project, it is on the systems of the software. This also what I mean by quality partner is if you go with very specific request, it has to be this training, it has to be in this region. That is not quality, right? I mean, it is quite volatile, it's dynamic, so they know better, whoever those proximate actors that are what is needed. So the more that you can be flexible and trustworthy, and that takes time. Again, it cannot be in 2 or 3 months. It's a number of conversations, visits, being authentic, also how you are learning as a funder, right? It's not just those organizations, and building that rapport. So I would say for funders that are considering, it is complex, it is very rewarding, because for me, that is impact. I think when we often speak about impact, I mean, there's nothing greater than saving a life. That is the impact. But I think when we often discuss impact is more the long-term sustainable. And it's true that in a complex emergency, but again, it's not a static black and white. In the case of Sudan referred, maybe this is the first time you don't want to engage necessarily in Darfur right now, but you can work in Khartoum, support organizations, right? It's relatively more stable. So it's not a black and white. And I think you just have to be really responsible, take time to educate yourself as a funder, and then choose wisely who are those partners that are credible, that know the context, that can pivot, and they're going to keep you informed also when things do not work. And you have to be honest also as a funder that in those complex emergencies, things might not always work, but they work some other way. That has been our experience.
You both touched on supporting local organizations, and you used the word proximate. Jason, I'm curious for you, with a large foundation and a global presence and portfolio of work, what does proximate mean to you, and how do you go about it in practical terms?
Yeah, I think for the foundation, the way we use proximate refers to how close an organization is to the communities that are going to be benefiting from a particular program or service, right? And we work with a range of partners. We work with universities, we work with governments, we work with multilateral organizations, with international NGOs, and certainly with a lot of national and local actors who we put into that proximate category. I think all of the organizations and partners that we work with, we believe add specific value and have different technical competencies. But for a lot of that last mile delivery work, where we're really trying to get critical assistance to populations that need it, there is nothing better than a proximate partner, right? I mean, I think that the kinds of qualities that they bring to the table in terms of community relations, in terms of the ability to have trust with local officials or key leaders. I mean, those are intangible to the success of a program. And there's a lot of ways that we can improve the delivery through, capacitating, through technical assistance. But the fact that they're there, and I know this cliche is a little bit old, but that they're there, before an emergency, during emergency, and after. I mean, it's really true. And I think that we find that they're an integral part of the work that we're trying to do, and we couldn't be successful without them. But that is to say that we see an ecosystem of partners that we like to work with, and certainly we need to figure out the best context where each of them can be successful and each of them can add value to the programs that we're supporting.
Gloria, you also mentioned the word due diligence, and this came up in the research. And as we know, for those of us that work in philanthropic organizations, this is something we're often thinking about, balancing flexibility with ensuring we're stewarding our resources well, we're making wise strategic decisions. You touched on it, but could you say a little bit more about what due diligence looks like for the IMS Foundation in this work and how you've managed that balance?
So we have the same due diligence process for all the organizations, international, local organization, but we already in 2 years and a half changed it already 2 or 3 times based on feedback. So I think it's so good within the parameters to learn and to adapt to the different actors. I think now we used to do it after our board would have approved a particular organization, and now we moved it before, because skeptical as I was at first, right, is doubled the work for organizations. It does allow us to surface areas that might need support that the program can help address. And for me, this is the risk mitigation strategy of the foundation, right? So if you're doing this, we see that this organization is working in a very insecure location, but they didn't have a security protocol, so they don't have security staff, right? So then can we budget that? And then the program will cover it, right? You're mitigating your risk if that's where you're coming from, right, as a foundation. And the organization is obviously mitigating those risks and making sure that there is those systems in place. We've learned a lot by doing due diligence with a lot of, you mentioned proximate and local actors, right? And unfortunately, the aid sector, and there's a lot of evidence on this, have not supported them adequately or equitably. So then obviously there's going to be some challenges compared to their international peers. So we've used that due diligence exercise to, for example, support them in building reserves, obviously paying overheads. They might need a different accounting system. So then how can the program cover it? So I think instead of seeing it, yes, as a black and white, it's been more, how do we use it in the design and adapt the program? And then obviously safeguard some funding of that program for organizational development, but that is demand driven. The organizations are deciding, right, what do they need to be in a strong and healthy area to provide better services to the communities. So I feel like still due diligence can be not the most pleasant of the exercises, but because it's done in a constructive and positive way, I think there is a lot of value to it.
Jason, is there anything you'd like to add from your and the Gates Foundation's perspective on how you address and manage due diligence?
Yeah, and actually, I can answer that. And then there was something Gloria said that I wanted to maybe add something else that resonated. So I think from our perspective, due diligence is more of an administrative component. It's something that we apply when we're considering working with organizations that we may not have worked with before, right? So it's usually more of a administrative determination about, is this an organization we can work with? And then what are some of the guardrails we might have to put in place, especially if they're not US based. And we want to set organizations or partners up to succeed. And so how do we put measures in place to make sure that our investment is going to be used for the right purposes when we're working with new partners, right? That's usually what due diligence is for us. In addition to looking at, U.S. laws, if we're working in places where there may be sanctions in place. But the point that Gloria mentioned that I thought was really important was around, this idea of understanding that proximate local actors may have additional needs that international NGOs may not have, right? And how can we support them in those specific requests? And I think, again, this is an added advantage of the philanthropic sector, is that we have a lot more flexibility in how we design budgets or support budgets for local actors. And so if there are things that they need that we would not necessarily think of, whether it's additional overhead, whether it's additional budgets for transportation, whether it's travel to go to other types of conferences where they can peer network, we try to be extremely flexible with them when they're telling us that here are the resources that we need to support these types of things that can make us the most successful moving forward, right? And I think we really try to listen and take that into account when we're making these funding decisions.
Thank you both. Yeah, those practical kind of examples are really helpful, I think, for those of us that are trying to imagine ourselves in this work. We are about to move into our Q&A section of the webinar today. So again, continue to add your questions to the Q&A box at the bottom. A last question, though, for you both. During our presentation on the research, we highlighted several solutions for engaging philanthropy in crisis settings. And one of the themes that arose is the importance of funders working together through collaborations or peer learning spaces. Can you just briefly share how both of you have engaged other funders and peers in your work and what has been the result of that engagement? Gloria, do you want to start?
Sure. I do think the philanthropic space, and you mentioned earlier, so diverse, so vast, there's thousands, right? And so fragmented that when you work inside philanthropy, and if you want to work in complex emergency or expand the number of partners you have in different ones, it can be quite isolating. You don't know how to do it, especially because foundations teams are quite small, right? You're not working when I work in large organizations. So I think it's critical for us to do better work, and also as individuals, as professionals, to be part of those funders group. For me, the one that I found really helpful has been the CDP local humanitarian, right, group that we meet every month. And the fact that you have already foundations that are interested in humanitarian, and two, that they want to advance the locally led is telling you that are like-minded individuals. And I think that's been a really helpful space, either if you want to work in a particular geography and you don't have the experience and leading on others that might have decades of experience working there. It might be about the kind of work that you want to be doing. Let's say you want to do insurances, and then that group is going to be able to help you navigate. So I would really encourage funders. And then within that space, then you find people that you align even more and then can have bilateral discussions. And some of the examples that have been really useful for me is I need to convince my board of, funding. I remember the first time mutual aid, and other funder can help me giving me their talking points, what they used to convince the first time they did, right? And I use that. So I think there are very practical ways that we can help one another to advance whatever the agenda that is.
Yeah, and I think I also have come to the realization, I think there are more foundations or philanthropic organizations than NGOs in the world almost. And so, trying to figure out who you align with is a little bit of a challenge. But echoing what Gloria said, the local humanitarian leadership collaborative. I know we're also a part of a forced displacement funders group, and I think these have been really great informal organizations to connect with other funders. I think in terms of what engagement looks like, it manifests in different ways for us. Sometimes it's just simple coordination, it's information sharing, it can be more concrete in terms of actual collaboration, perhaps co-financing on different initiatives. It can be more tactical thought partnership, but it can also just be an exchange of peer networks. Oftentimes there are funders that are looking to work in a country that may not have a good network of organizations to connect with, right? And I think others that are active there are often very willing to share information with about their networks. I think what we've seen is that these funder networks, sometimes it's difficult for different philanthropies to align on a goal, but I think there have been some really successful results over the last couple of years. The one that comes to mind is the Funders for Mutual Aid in Sudan, which is a group of funders that at CGI's 2024 annual meetings, there was this commitment to action to elevate the role that philanthropies could play in supporting mutual aid groups in Sudan. And I think that's been a successful initiative. But I think in other instances, that success is less visible, but not less important. And that's really the engagement that addresses some of the barriers that CDP identified in the report, right? How do we help give other funders visibility into how to work in different complex emergencies, or how do we make them feel more comfortable about overcoming some of their concerns about working in those places, right? And I think that's a role that other funders can play that have actual experience from those environments.
Thank you. That's really helpful. And it's always good to see, despite our unique contributions to the field and to the work, there's also opportunities for synergy and connection. So thanks for highlighting those. We're going to bring Marina back into the conversation as well and move into our question and answer phase. We received some questions in advance. I see some questions, of course, in the Q&A box. Unfortunately, we're not going to be able to get to all of them, but we'll work through them diligently. And as a reminder, CDP webinars are designed to provide education to the philanthropic community. So we'll try and focus on those that are addressing funder or donor issues. And so one that I want to start with that I see in the Q&A box, but also aligns with a couple questions that we received in advance, is this recognition within the research and the finding that funders often feel outside of the humanitarian sector, and maybe it's not designed for them. And there are also some questions about, in light of all the changes in the development humanitarian field in the past year, how are you all working in that new environment, and if you're thinking to shift it at all. So I think there's a two-part question there. One is you all have significant experience both in the philanthropic and the humanitarian space. So from your perspective, how can humanitarian organizations meet philanthropy in that way, or how can we better work together? And then a second part is, has your thinking shifted at all, given all the shifts in the aid sector in the past year? Jason or Gloria, does one of you want to take that on?
Yeah, I can start. I mean, from my perspective, I think historically, philanthropy and the humanitarian sector have operated in silos. I mean, this was my initial experience when I was starting out in the humanitarian field, is that there wasn't any kind of real collaboration or engagement, and we just haven't always been acting as if we're on the same team or working from the same playbook, so to speak. And I think there are real challenges in identifying mission alignment between what philanthropies do and what the humanitarian sector does. But I think to close that gap, I think really the most important thing is acknowledging that there's a problem, or that there's a barrier. And I think that's why this research is really important and critical. And I think the second part is in acknowledging to each other that we should be collaborating more, and then assessing how we work together collectively, right? And I think there's been a lot more. I've been encouraged, I would say, because I think there has been a lot more of this direct collaboration since the dismantling of USAID and some of the funding cuts overall, is that there's been more of a deliberative effort to engage between humanitarian and philanthropy about how we can find a pathway forward, or where those opportunities exist. I think for us, we've been trying to monitor everything. We've been talking with a lot of partners since last year. I think, I don't want to say the situation is stabilized. I know there's still some things that are shifting, but I think we've tried to be a good thought partner in terms of how we can support them, or where our resources could be most critical as they're going through some of these shifts. But it's still a work in progress.
Gloria, is there anything
Maybe
you'd like to add?
I think maybe briefly, I think the traditional humanitarian sector has not always been easy for anyone else that was not humanitarian to engage with. I think philanthropy is one, but I think that anyone that was not considered humanitarian, and I think there was a narrow definition there, did struggle, right? The jargon, the pace of things where decisions are made. And I think now with the shifts, for lack of a better word, it's much more open, right? Because it needs cash, but also different actors. So I think there is an opportunity there to, again, with philanthropy, but with other many actors that were not. This could be more community efforts. This could be feminist funds, indigenous, you call it, anyone else that was already doing crisis response was not part of that sector. What I do see in terms of the shifts, recognize that they've been very painful, from communities to NGOs over the past year, and sadly seems it will continue, is that there's an opportunity, I don't think for reform, in my opinion, but to reimagine something different. And the way I see it as a grant maker is I will devote some of the resources to try to continue to reform that core, that transform that traditional sector, but most of our efforts will be to this reimagining, right? And again, mutual aid is just one example, but that everybody has been very inspired by the work, again, incredibly difficult circumstance. So how can we resource and elevate some of those efforts? Or recognizing other forms of peace building from indigenous communities that are all in this complex protected emergencies? Or what can the private sector, academia, other kind of actors, right? So being much more open-minded on who has the best solutions for me. I care less who's a humanitarian and more what is the solution to this particular problem, and who obviously it's best proximate to fix it. But also I think philanthropy can play a role within the system and there's many players. So how do we rebalance what was before was a bit of a monopoly?
Thank you both. Marina, a question for you that we received in advance. Gloria and Jason have both talked about working with local or proximate organizations. Is there anything from the research that you want to share or comment on? The question is, what helps funders feel confident moving flexible funding quickly to frontline and local responders in underfunded crises?
Oof, great question. Thank you, Austin. I think some of the two key issues that came up when we spoke with funders about it have been, first of all, we don't know who they are. So we do want to fund locally, but we don't actually know who's the local organization that we should be supporting. That was one of the most difficult obstacles that funders cited, far more limiting than sanctions, anti-terrorism checks, and other legal, fiscal, etc. Assurance considerations. And the second biggest issue has been, but there's so few of us on our own end, so we don't know how to due diligence, how to de-risk. That was the word that I learned when I spoke to funders, de-risk those local organizations that we do want to support, but we want to just choose those that are most likely to deliver the best results for their communities. And in this case, I think the answer to both of them could be working through intermediaries who would have already had a footprint in those locations. I know something like that happened in Sudan through several intermediaries, including CDP, but also to invest more time in funding those finding and funding those local partners. As I mentioned in my earlier contribution, that there were a couple of funders that we spoke to who said, yes, we are a tiny team, but we do dedicate our time to meticulously search for those local organizations that continuously perform well. And when something happens in that context, we have a list ready of those people that we are going to fund.
Thank you for that perspective. That's helpful. We need to wrap up, but there's one last question I'll ask Gloria or Jason, one of you, to chime in on if you're willing to give a 30 to 45-second response, even though that's a difficult task. There's a question in the Q&A about how can less experienced philanthropies realistically support in complex crises? Those of us on this call come from a combination of both environments, and that is an added value inside an organization to have that expertise. But what about organizations that maybe have staff who are willing and are passionate, but maybe don't have that kind of technical experience or lived experience? What would your kind of top line recommendation be for them? Do one of you want to take it?
By illusion, we are one of those. It's not like the Gates Foundations, we're just 7 years old. My first would be call me. Call me and we'll work it out together. I mean, I think once there's the willingness, anything can be overcome. Convincing boards, doing due diligence, proposals, travel. And that's where I'm saying that contacting other funders, either through this funders collaborative that Jason and I have mentioned. This is why we do this kind of webinars, right? You can reach to Jason, to me, to Austin, and there's multiple ways. There's many pathways, many great local organizations all over the world. So actually, that's what I was saying. It's quite easy. So for me, if there is the willingness, you can learn, you can network with others, and it's very, very easy. So. I'm sure Austin will contact everyone and share emails. Please do reach out.
I just wanted to echo what Gloria said, 100%.
That's great. That's a wonderful place to wrap up that portion of the webinar. Is you can see the desire to just help each other and work together and to provide insights and learnings from the work. So thank you all. Thank you to Marina, Jason, and Gloria for this great discussion. I do want to share some thoughts for action from the webinar today very quickly. You do not need a dedicated disaster or humanitarian portfolio to support communities in crisis and advance your mission. You can consider how your mission and priorities align with crisis contexts. Second, join a coalition or network. You heard some of them named today. This can ensure that you don't work in isolation, but allows for candid conversations, sharing of knowledge, and greater collective effectiveness. And lastly, working with others and utilizing intermediaries, for example, can help mitigate potential risk concerns. One strength of philanthropy, as we heard today, is its ability to take on risks and be flexible. This webinar is just one of CDP's many resources and offerings. You can see some of them listed here. We encourage you to visit our website and learn more about our recovery funds and the variety of resources and services that we can provide. I encourage you to join us next month for another webinar on this similar theme of philanthropic engagement and complex humanitarian emergencies. The title of that webinar is Beyond the Headlines: What Mobilizes Philanthropy to Act in Complex Crises. The event page and registration information will be published on our website later this week and eventually shared on our social media. So keep a lookout for that and please register for that event. I'm afraid that's all the time that we have for today. Thank you to our promoters for getting the word out about this event. And thank you to Marina, Jason, and Gloria for sharing your insights and expertise with us. Please take a moment to complete our post-webinar survey to let us know what you liked and what you would like to see in future webinars. It will pop up automatically when you exit the webinar. If you have any questions that were not addressed during today's webinar, or if I can be of assistance, you can email them to me. Thank you and have a great day.